All right, well, now we're recording. At least I hope so. So as you can tell, we're figuring this out. We are actually live at the Portland State Office building with some equipment. So it's a little different from us. We're not doing this remotely from our homes. So please, thank you for your patience. Let's see. So the next thing is around continuing education credit. Again, you're going to receive 1 hour of CE credit for today's virtual training session. You'll need to complete the short quiz and training evaluation form before receiving the CE credit. We will include the links in the chat box at the end of the training, but as a backup, please type your name and your email address in the chat box. And I notice a lot of you are already doing that, so thank you. And then once you've submitted your answers for the quiz and training evaluation form, the CE form will be emailed to you. So I'm going to go ahead and pass this over to Karen Phillips.
Hi, everyone. Welcome to our final presentation on infection control. So this is the introductory part of the day, and then we'll be doing some live demonstrations. And this infection control is very COVID-based, which I know everybody is very interested in. Looks like there's a couple. Just going to admit a couple people here. Okay. How do I click back on here? Okay. Yeah. All right. Okay. Okay. Sorry, I'm using a different computer and a different mouse. So the guidance that we are following today, as well as our guidelines that are in draft and working their way through review, are from OHA's COVID-19 website, and I put the information on the slide. But we're following CDC guidance for dental settings, updated August 4th, OHA's guidance on resuming non-emergency dental procedures in medical and dental office, ADA's guidance, ADHA's guidance, and sorry. Yeah, sorry. It's hard to, yeah, okay. And at the bottom are guidance for certified school dental sealant programs and guidance for resuming dental services in school settings. And that, most of you know, is out for review with stakeholders, and any comments are due end of day Monday. Okay, sorry, how do I? Presentation. Oh, got it. Okay. Okay. CDC guidelines are based on available research. Currently, they're more detailed than previous guidance. The previous guidance, a lot of general recommendations that were up for certain levels of interpretation. And the guidance for COVID, as you know, has been updated frequently, and that applies to other guidance with OHA and OSHA. And so for our school dental sealant program, OHA, we follow pretty strict protocols to make program exemplary, and are also based on research, CDC, OHA, and other national and global and state subject matter experts. Some information on the transmission and risk of COVID. How do I? I'm trying to admit somebody. There we go. Okay. So SARS-CoV is the name of the virus, and it's new and much is unknown. It spreads easily and primarily from person to person. However, and it also may be spread by people who are asymptomatic And spread through aerosols is less likely, but a lot is unknown about how it may or may not be spread through aerosols. For our risk, the dental profession is very high risk. We use rotary instruments, ultrasonics that create spray. And we have exposure to water, blood, saliva, and other microorganisms. And currently there's no data to assess the risk of the virus or virus transmission in dental settings. And I'm sure you've seen this graphic on the risk of its various professions' risk of exposure. And hygienists is like the highest over on the right-hand side because we are exposed time after time if we're using ultrasonic to the aerosols, and we're seeing a lot of patients. So our guidance and the CDC guidance for dental and school dental sealant programs create a written infection control protocol and evaluation plan, stay healthy and learn about SARS-CoV-2, the virus, hand hygiene. We've heard constantly since March to wash our hands often for 20 seconds with soap and water, and if you aren't able to wash with soap and water, use an alcohol-based hand sanitizer with 60% or higher alcohol, and rub your hands for 20 seconds with that. Have administrative controls, engineering controls, environmental infection control, personal protective equipment, sterilization of patient care items and dental unit water lines. Though we're not going to cover much of that because those haven't really changed, except that if we haven't used our equipment much since March, and so it's important to make sure that everything's in working order and is clean. This is an example of OHA's written infection control program, and I am happy to send this out when it's completed. It's still in draft form, but it's mostly done. We're staying healthy, stay up to date on immunizations, stay home if you are sick or even under the weather, just not feeling well. Learn about the virus, and then I put a website for access to information for trainings and PowerPoints on learning more about the disease. The National Network for Oral Health Access, or NOAA, and the Association of State and Territorial Dental Directors, or ASTDD, also have information on the virus, as well as the ADHA and ADA. For certified school dental sealant programs, we must screen all personnel reporting to work for COVID-19 and follow the CDC guidance on updated symptoms. We need to maintain daily logs of the students who are served on any given service day and be ready to provide that to school personnel, school nurses, if they need it. School dental sealant program personnel must stay home if sick, must report the development of symptoms or illness to a supervisor immediately, and also must follow the ODE guidelines for wearing masks or face coverings in the school environment. We don't have a vaccine for COVID at this point, but still stay up to date on the other vaccines. For hand hygiene, wearing gloves doesn't eliminate the need for hand washing. Talked about washing your hands often, use alcohol-based hand sanitizer. And it's important to cover all of the parts of your hand, the front of your hand, the back of your hand, your fingers, fingernails, whether you're using soap and water or the alcohol-based hand sanitizer, and rub for 20 seconds. If your hands become soiled, they need to be washed with soap and water, and then you can go back to using alcohol-based hand sanitizer. Administrative controls include having one patient or student at a time, Maintaining 6 feet of physical distancing in everything that you're doing as much as possible. That's not possible in the clinical service area when you're providing services. Wear masks and face coverings, avoid aerosol generating procedures, and if you are doing an aerosol generating procedure, you're required to use high evacuation, and it's preferable to use four-handed dentistry to collect those aerosols, but also have only the dental health care personnel in the room that are needed to manage the patient and the procedure. And set up your operatory so that only the items needed for that procedure and that student are in that area and that are accessible. And a direct quote from CDC about that. Engineering controls include things like properly maintaining ventilation systems. That's not something that we have control over in the schools. And consider using HEPA filters. The dental works units are, they are finishing up developing an ULPA filtration system that's a box outside of the compressor, and that apparently filters even more than a HEPA filter. So modify your portable dental compressors. Use individual rooms when possible, and for open floor plans, and there are programs that use a couple of dental chairs or a few dental chairs and have several teams running at once. And so they need to be 6 feet apart at least, and then if they aren't, have barriers in between them, and the barriers must be able to be cleaned and disinfected. And allow enough time between patients and procedures to properly clean and disinfect. So this is if you're performing aerosol generating procedures, have the barriers and 6 feet of physical distance, must set up on a non-carpeted surface. So ideally on a bare floor, or if you're on carpet, have some kind of surface that you can clean and disinfect. And you need to distinguish between your clinical service area and kind of an administrative service area where you would do paperwork. For environmental infection control, not only do we need to follow our manufacturer's directions for the disinfecting agent that we choose, but we also need to make sure that it is on the EPA approved list, and that's list N. And it may have different guidelines for virus than what it's said on your manufacturer's directions. So you need to check both. And we use Cavicide 1, and the EPA recommendations is that it's a 3-minute wet contact time for disinfecting. Other options for environmental infection control, the efficacy isn't known on these options. Ultrasonic waves, high intensity UV radiation, blue lights, or sanitizing tunnels. This is what the OHA School Dental Sealant Program is going to be using. We're going to have barriers on our chair head, our light switch, and our lights, our glass ionomer capsule applicator, and our triturator switch. For AGPs, if you're using, well, you would have a compressor, so you'd want to cover your compressor and have your air water syringe, suction handles, cure light, and barriers on your sealant and edge syringes. Some information about donning and doffing, and Lori and I are going to be demonstrating this in a little bit. And this is on the CDC website. So for putting on equipment, put a gown on. It should fully cover your torso. Put on a mask, goggles or face shield, gloves, and you're using hand sanitizer throughout this process as well. Removing, there are two, this is one example of how to remove PPE. And then this is another example of how to remove PPE. So for gowns, OSHA requires the sleeves to cover providers to wrists. The CDC recommends disposable gowns, but launderable gowns are acceptable. They do need to be laundered according to the manufacturer's recommendations and CDC. Change gowns between each student receiving a dental service. They don't need to be worn to do a screening, and if you are using a gown for a screening, they don't need to be changed between the students receiving screenings. Remove all gowns or all PPE before leaving the clinical service area. N95 masks, there's a lot floating around out there. They must be FDA cleared or NIOSH approved. Avoid counterfeit masks. And N95 masks are designed to be a very close fit to the face, covering the nose and mouth, and they filter 95% of airborne particles. Surgical masks, we've talked about this before. There's 3 levels, low barrier, level 1, low barrier, 2, moderate, and 3, high. Level 2s and 3s can be used for if N95s aren't available, and there's a face shield. And so for glass ionomer, the modified technique, we are going to be using a level 2 or 3, ideally level 3 if we can get them, and our face shields. OHA recommends N95 when performing aerosol generating procedures when using an air water syringe. We talked about non-AGPs. And it's also recommended by the CDC, and it's okay to wear your mask, to wear one mask during your entire shift, as long as it isn't contaminated and you haven't touched it. And that's actually better to do that than to continually don and doff a mask, because there's more concern about possibly cross-contaminating the more masks that you're putting, taking off and putting on. Eyewear, personal eyewear, such as what I'm wearing, is not protective eyewear. It can be worn under a face shield. But eyewear that has gaps at the forehead or in behind the eyes may not offer protection. And if you're wearing protective eyewear goggles, they must have side shields and also fit right to the forehead. Avoid touching your eyewear during procedures. Follow the manufacturer's directions for loops for cleaning. And this is some observations from site visits, not this past year, but the year before. So for cleaning oroscopic loops, they've updated their information for COVID. And so this is their recommendation. And they recommend using Cavicide. So this is information about sharp safety and sterilizing instruments. If you're using resin etch and sealant, dispose of the tips either at home or in a dental office. Place any sharp instruments in a puncture-resistant container when you're transporting it. For sterilization, assign one person to monitor the program. Always follow manufacturer's directions for your sterilizers, type of pouches that you're using. Wear PPE during the process, and monitor mechanically, chemically, and biologically. Mechanically means checking the gauges on the sterilizer. Biologically are biomonitoring that we do weekly, and then chemically are the indicators on the pouches, as well as indicator strips or tape. Critical and semi-critical items are generally what we use. They require heat sterilization, and non-critical contacts only skin can be cleaned and disinfected. Things like air water syringes, suction handles. So we've talked before about the caps on the sealant and etch syringes. So the sealant and etch syringes need to be cleaned and disinfected with their storage cap on. This cap needs to stay on until they are ready to be used. So they can't be stored with the tips. And so put the storage caps on before you start your clean and disinfectant process. So the CDC and American Dental Association require weekly spore testing every week that patients are treating using indicator strips or tape in every time the sterilizer used, and then monitoring the gauges and pressure. And this is the Oregon Board of Dentistry requirements, and no changes. And remember that the licensee is responsible for this and also needs to have 2 hours of infection control every licensing period. For the Prestige medical sterilizers, they're the sterilizers that look like a pressure cooker. Instruments can be sterilized in the sterilization pouches, but they have to be specifically for steam sterilization, and don't overload the sterilizer. Place about 6 if full pouches loosely packed in the sterilizer. Label and date the pouches once they have dried. And this is information about the water lines, and this is from Bob Kennedy at Dental Works. Use an approved water line cleaner additive. Purge the system at the end of every day and empty the bottle and leave the cap off. Until next use, clean out the evacuation system in each day with like Maxivac or something like that, and drain the air tank and purge the line at the end of each day. And I checked the CDC app to see if it had any updated information for COVID, and it does not. It still has a checklist available, and you can still access CDC guidance, but it's the older CDC guidance. There isn't any updated guidance for COVID. Additional infection control resources, this is from OSAP. Okay, any questions? Okay, I'm going to turn it over to Amy, and we're going to get ready for our next portion, and Amy will let us know if there's any questions.
All right, everyone, so if you do have a question, go ahead and type it into the chat box. I'm going to go ahead and stop sharing this, and let's see if that's working. All right. Britt, you may want to. Okay, so there is a question. Will you be sending the PowerPoints out? Yes. So the recordings of the Zoom webinar as well as the PowerPoint presentations will be saved on the website. But I'm talking through here. Oh, shoot. Okay, hang on. Sorry. Available to you guys by the end of next week. Britt, I'm not sure if they're seeing the room. Can someone type in whether they can actually see like a room setup? Okay, we cannot see the room. So what do you want me to do? Okay, can someone see the room now? Okay, yay! All right, then I need to let her in, I think. Okay, so it looks like you guys can see the room, so I'm just going to be quiet. Okay, so we have set up a clinical service area, and we're going to walk through the room and show you everything we have. And we are set up for resident. Okay, so hang on. We can barely hear the person speaking. Okay, so Normally, she would have that on, but for the purposes of being able to hear, she's going to put the face shield on instead. Just know that throughout the demonstration, that she's not hearing it accurately.
Yes, normally I would have a mask on. I didn't even put my face shield. So,
All right, they can't hear still. Not any better. So what do you want me to do? Which one? Is it this one? Okay. Karen, go ahead and try it.
okay, how's this? Can you hear me?
Yes.
Okay, perfect. Okay, so hopefully you heard what Amy said, that I am not wearing a mask under my face shield so that you can hear me better, but normally I would be wearing a mask under my face shield. So what we have here is a setup, a clinical service area. There is blue tape around everything, and it's 6 feet from the compressor and the head of the chair, so like the aerosol generating area. And you wouldn't be on a carpeted area. There would be some, like the mats or some kind of bare floor or surface that underneath the chair and in your 6 foot area that you can use, that you would have to clean and disinfect after each student if you're performing aerosol generating procedures. So we have, we are set up right now, but when we kind of work through our flow, we aren't going to be set up because we were gonna, you would have your wet contact time and go off and do your screening, and then you would come back, open up your setup and have the setup ready. But for the purposes of touring our room, we have everything set up right now. So we have just what we need for the student on the tray and over on the assistant side. A unopened pouch of Explorer and mirror, disposable, reusable instrument. You can have disposable. Our sealant nets syringes have their caps on and barriers, and we have our tips there. Compressor, if you were going to be doing glass ionomer, the non-modified technique, you need to have your compressor available. If you're doing resin sealant, you're going to have your compressor. You have a cover over the unit here and the holders for the suction and the air water. A note about the suction, if you're doing aerosol generating procedures, you need to use, it's required that you use high evacuation suction. Dental work compressors, you can't have a saliva ejector and high speed and high evacuation suction on the same unit. So you would have to have a separate unit that would offer the high evacuation suction, and then you could have your saliva ejector on this unit. We have a bin here to dispose of our contaminated gowns after we've performed a service. You'd want to have a bin there for your disposable gowns or for your launderable gowns. And then this is the assistant area. And we have out here only what we need, again, for the student, and then to begin our disinfecting procedures. We have a lot of masks here. We put masks into our setup. So there's plenty of masks here to do the treatment as well as for the assistant to do their cleaning and disinfecting. We have our barriers, student eyewear. This is our triturator for glass ionomer. These are capsules for glass ionomer. And if you're doing a younger student, you would have 1 capsule. If you're doing a middle schooler or high school, you would have 2 capsules out, and they could be in your setup. Garbage can underneath the chair, we have our soak solution to place dirty instruments, and then barriers on the light switches and the light switch and the light itself. So this is our bin with our extra supplies, and it's within our 6 feet from our chair, but it's outside of the 6 feet from the compressor and the aerosol generating area. And inside the bin, and then also in this little tabletop bin or some extra supplies that are covered. And then the paper towel here is for the student to place their mask when they enter into the clinical area. Okay, any questions about that portion? Any questions, Amy?
No, no questions.
Okay. All right, so now Lori and I are going to demonstrate putting on, well, actually, we're going to demonstrate screenings first, and then we'll come back and do some other demonstrations. So this is our administrative table. This is our screening bin. So our screening bin, and this is what we're going to take to the classroom or the hallway outside the classroom to do our screening. So we have a garbage bag, gloves, disposable mirrors, hand sanitizer, and then thermometer and iPad. And so both the hygienist and the assistant are going to go to the classroom, call out one child or one student, and record what they need. If they don't need sealants, still record their information, have them go back into their classroom, and then call out the next child. You'll also have a handful of permission forms with you. And then you'll do that until you have a student that needs sealants. So if our second student needs sealants, we're going to enter that on the iPad, take their temperature, record their temperature on their chart or in their iPad, and then if they are below, are they within the normal limits, then they can be escorted back to the clinical area. If they have a fever, then you need to let the school staff know. Okay, so our student needs sealants. So we are going to walk back to our clinical area. Any questions about that, about the screening? Okay. Okay, so the student has come with Lori and I back to our clinical service area. The student is going to wait here with their mask on or face covering on until we have put on all of our personal protective equipment. So the first thing that we're doing is hand sanitizer, rub for 20 seconds. And we're putting on our gown. The gown should completely cover your body. Tie any of the ties. And so this is kind of our staging area, and we have stacks of clean gowns ready to go for each time that we need to put on our protective gear. And so I would normally have and we would have normally had a mask on and a face shield. And if we didn't, though, we would put a face shield on. I'm going to pretend I'm putting a face shield on, and I'm probably touching my hair and ears. So I'm going to use hand sanitizer again for 20 seconds. Get gloves. On the gloves, and the gloves need to go over the cuff of the gown. And then we will be stepping into the clinical area. The student, this is a clean paper towel. Student will place their mask face down on the towel, and then you have another clean paper towel to put over the top. Go ahead and seat the students. Sit down. our setups are here. So if we would have just come into everything just being dried during our screening, and then Lori would grab our setup behind there, and then all of our barriers and supplies are in here. So we would reset up the child their eyewear, do the sealants, and then the hygienist and the student would be ready to leave the room. I'd remove my gloves, hand sanitizer, remove my gown, and it's okay to break the ties, but remove it inside out. Put it in the bin. Use hand sanitizer. And the student is with me, and I'm going to remove my face shield, and I'll put my contaminated face shield at the end of the chair for the assistant to clean and disinfect. And the student is going to grab their face mask, use hand sanitizer, step outside for administrative area where we fill out the form, hand the child any prizes or stickers. Don't have a bin there of prizes and stickers, hand them what you're going to give them, and then either escort them back to the classroom or let them go back to the classroom. Make sure they have their face covering on. And then when the hygienist comes back, they're going to be waiting. Lori is cleaning, removing all the barriers. After removing the barriers, she used hand sanitizer. She took her gloves off, used hand sanitizer, and put clean gloves on, is performing the clean step with Cavicide. And she started this as soon as the hygienist and the student left the room. And the clean step is a 30-second time. And she still has all of her PPE on, removing her gloves, using hand sanitizer for 20 seconds, donning clean gloves, and then she'll be performing the disinfecting step. Okay, and then
there's a question.
Okay, what's the question?
When do you return the student's mask to them? Your gloves were removed early.
My gloves are removed.
Okay, so first, when do you return the student's mask to them?
Well, they can get their own mask.
Okay. Never remove the dirty gown with dirty gloves and hand sanitize after.
Well, if you have your dirty gloves, you're more likely to be touching your clothes and your hair with dirty gloves. You know, did people hear that? Okay, so Lori is taking off her gown, her disposable gown, and hand sanitizer. Stepping out of the room, she would have grabbed my contaminated face shield and put it over here to and do a cleaning and disinfecting step with alcohol on the inside and disinfecting on the outside. Okay, it looks like we've got plenty of time for questions. So Lori's going to go through that cleaning and disinfecting step for the face shield.
Okay, so we have several questions.
Okay.
You may want to repeat it close to the microphone. Why are we removing a dirty gown inside out with clean hands? Can't we remove the dirty gown with dirty gloves and hand sanitize after? That's the whole question on that one.
Right. I'm just going to walk through here. Okay, so if you have dirty gloves on, your gloves are contaminated, and there's a chance that you are touching your hair or your skin with dirty gloves. So that's why you are removing your gown, and then you're going to hand sanitize again. And that's the CDC says to remove your gloves and then remove your gown.
So the next question is, so for hallway screenings, we are only wearing a mask, no face shield or gown, correct?
We don't have to wear a gown. We are wearing the face shield. And then, sorry.
So I would just think for hallway screenings.
Oh, for hallway, okay, I'll repeat the questions, okay. Okay, so for hallway screenings, we are wearing, the question is, are we wearing a gown? And do we need to wear a face shield? And so no, for screenings, you do not need to wear a gown. And then for face shields, we are going to be wearing a face shield and a mask. So either you need to have a face shield or a mask and goggles. I can repeat the question.
So I think at this time, if you have any questions, go ahead and type them in the chat box, but we do got time if you want to unmute yourselves, and we can answer questions that way.
Okay. And if there's anything else that you would like me to show you or redemonstrate.
What is the shaker in on the table?
We don't actually have a triturator in person, so that's our pretend triturator until we get one.
It looks like a tub.
It is, but it's our pretend triturator. Any other questions in the chat box or?
Can the child simply hold their mask instead of placing it down on a paper towel?
I think it would be better for them to remove their mask and have it be outside of the aerosol generating area, and that's why we are putting it away from outside of that 6-foot range. I mean, if we think about it, they are going to be exposed on their face, but I think it would be a good idea to not have their mask be sitting there the whole time. So I think it would be better to put it away from, to not have them hold it during their procedure.
Okay, next question that we'll repeat. We'd be cleaning the floor too between every kid with sealant and with what?
Yes, sorry, I neglected that part. So yes, you would be cleaning the floor, and you can get, you can use like a Swiffer and then have some Cavicide wipes or do some spray or something like that, and use the Swiffer. And then you can also have rags or paper towels or something that can be used with a disinfectant to like mop it with your feet sort of thing. But make sure whichever if you're using a rag or paper towels, that it doesn't break down the disinfecting product.
Okay, so what if the only option in the school area is carpet?
The question is, what is if the only option in the school area is carpet? So then you need to have something to make sure that it's on either, that there's a barrier, so floor mats. You could potentially use a tarp or some plastic or something like that, but it either needs to be rolled up and disposed of between students, or it needs to be cleaned and disinfected. And that's for aerosol generating procedures. We are going to have mats, even though we are going to be using the modified glass ionomer technique. Any other questions about the PowerPoint or donning, doffing, our setup? And I just,
at what temperature would the child be considered to have a fever and not seen for services?
so the current guidance is 100.3 is when they are considered having a fever. We are going to use 100 as our threshold for our program. And that, so you need to follow the CDC guidance because it has changed a little bit over time. But 100.3 is what it currently says for CDC.
If you use modified technique, do you need to clean floors every time?
Question is, if you're using the modified glass ionomer technique, do you need to clean the floors every time? And the answer is no. I would clean them at the end of the day, though.
Disinfect everything before you do
Yeah. Okay, any other questions? We have.
Where do you put extra supplies for a student if you need something extra during treatment? Say you dropped a cotton roll or something and need another one mid-treatment.
Right. So the question is, where do you put your supplies if you need something mid-treatment, like if you drop a supply or cotton roll or something? And our bin, it's in our blue line, but it's outside of our 6-foot area. So our bin over here has supplies inside the bin itself, and it also has the little tabletop smaller bin right here that has some supplies. So you could have, the things in there that are most likely to be needed or dropped. When we did setups, we had extra things in there to hopefully take care of anything like that. But this either needs to be, if it's inside your 6-foot area, it needs to be in a closed container and covered, or ideally it needs to be outside of your 6-foot area. And I just want to say, for what we did today, it's based on what the current guidance is from CDC and OSHA and follows our recommendations from our draft guidance document. And things may change. It may change before we go into the schools. It may change mid-year. And I will keep you updated and let you know if there's different requirements as we go through the year.
So this is Amy, and as I kind of watch this kind of production today, I guess some key takeaway lessons for school sealant programs is please practice before you go into the school, because every little step you have to pay attention to. And today we had two. We had a dental hygienist and an assistant helping, but for those programs that are only going to have one hygienist go into the schools, it's really important that you do that practice and figure out the workflow of that person doing it alone, because there's a lot of extra steps and things that you need to think through than normally you would. And if there's any last minute questions within the last 5 minutes, go ahead, type them in the chat box or unmute yourselves.
It's really important to not take any shortcuts. It's important anyway before COVID, but now it's even more important to not take any shortcuts in keeping the students safe and yourself safe.
Can you demonstrate protocol using loops?
For we actually have face shields that fit loops, but neither one of us wear loops, and so you would have a face shield that fits. Oh, so sorry. The question is, can you demonstrate protocol for loops? So you can treat your loops as eyewear. You would have a face shield over them, and there are face shields that have cutouts or they stick out farther to allow for loops and a light. And so the face shield part of it, the protocol would be the same, but the loops part, you would follow the manufacturer's directions for cleaning your loops, and they recommend Cavicide. And so you would treat them like eyewear. Like I had my eyewear on the whole time, and then I put my face shield over it. And if you're touching your, if you're flipping your shield on your light or adjusting your loops or something like that, then you need to remove gloves, clean them in between. Does that help? I know there's a company called OptiDop. It's OP-D-DOP, and apparently they have great face shields to wear over loops. They fit loops really well, but they're very back ordered. We're just checking the chat box for more questions. No? Okay. Okay, last call for questions, either in the chat box or chiming in. And like Amy said, we will be posting the videos, the recordings, and the PowerPoints and the quizzes all online by the end of the month.
Okay, there is a question. I saw you entering the consent on an iPad.
The question is, I saw you entering a consent on the iPad, and I'm not, could you rephrase the question?
And the other one is, please note the face shield company again.
The face shield company is OptiDop. So it's OP-D-DOP, and if you Google it, it comes right up. And can you repeat the question about the consent on the iPad? Are you asking if we had our consents on the iPad?
On the Holly screen, oh, never mind, it was keeping track of the temperature, correct?
Oh, yes. So we have a field on our iPad. So for the temperature, we have a field on our iPad to enter the temperature and record the temperature. So you need to have a field somewhere that you're keeping track of your the student's temperature.
And it looks like Silver included the link for the face shield company in the comments.
Great. It sounds like Silver from One Community Health entered the link for the face shield for OptiDop. Okay. Oh, no. Okay.
We're gonna stay online.
Okay, great.
I'm gonna send the link to the.
Okay. So we're not going to be filming, but the Zoom will be open, and Amy's going to put in the link for the evaluation and the quiz, and we will keep the Zoom open for a while to give you the opportunity to take the quiz and complete the evaluation.
It looks like CP said ultralight optics for loop accepting shields.
Okay, somebody, if they can put that in the link, somebody mentioned another face shield company, and if you can either write in what, yeah, the name or the link, that would be great. Okay, we're gonna stop our recording. Thank you, everybody. Thank you very much for your patience and all our technology over the 3 days that we've done the training. Bye. No, yeah, no, no more.